An arrhythmia is an abnormal rhythm of the heart. Um, a normal heart rhythm or heartbeat is generated by electrical impulses passing through the chambers of the heart in a coordinated and controlled manner. If this is disrupted in any way, this will cause an abnormal rhythm of the heart, and this is called an arrhythmia. Broadly speaking, there are three types of arrhythmias. One are slow rhythms of the heart that we call bradyarrhythmias or bradycardias. Secondly, are fast rhythms of the heart called tachycardias or tachyarrhythmias. And the third group is an irregular heartbeat, which are usually due to extra beats or what we call ectopic beats. Certainly, the rhythms can range from mild to serious. And again, this depends on the type of rhythm disturbance we are talking about. Generally, slow rhythms of the heart can cause problems if left untreated, that it can cause individuals or patients to pass out. Fast rhythms of the heart, it depends where the rhythm is coming from. And again, rhythms from the main pump or the ventricles tend to be more serious, and if left untreated, can cause problems in the future. Other rhythms of the heart, such as extra beats or ectopic beats, tend to be benign and very mild. And there are other rhythms of the heart which tend to be in the middle, if you like, which can cause a moderate risk. But again, it depends on the type of rhythm that the patient has. The causes of different rhythm disturbances are varied. If we think about slow rhythms of the heart first, or bradycardias, they tend to happen as a consequence of the electrical impulses not being generated by the heart properly, or due to the failure of electrical impulses passing through the heart. And this tends to occur as people get older, as the nerves and as electrical impulses generally get a bit slower. So this tends to be a condition that affects the elderly more than the young. The faster rhythms of the heart, again, because there are so many different types of fast rhythms of the heart, can have a number of different causes and triggers. There are some rhythms of the heart which happen as in childhood, and these can be rhythms associated with extra nerves in the heart, causing what we call supraventricular tachycardias. Other rhythms of the heart can occur as a consequence of damage to the heart itself due to other conditions, such as heart attacks, for example, which can cause scars in the heart. And this can predispose individuals to ventricular rhythms of the heart. In terms of triggers, again, this is very varied and and depends on the type of rhythm disturbance that we're talking about. There are some rhythms that can happen only with exercise or stress, other rhythms that can happen in the middle of the night, and other rhythms of the heart which can just happen sporadically. And this can have quite a significant impact on patients' quality of life due to the sporadic nature and unpredictability of the rhythm itself. So, different rhythm disturbances have different treatment options. I tend to think of it in three different ways. One is either nothing needs to be done, and certainly if the rhythm itself is benign and very mild, then you can just leave it alone and just monitor it with time. Certain rhythm disturbances require specific treatment in the form of drugs. There are certain drugs, particularly for fast rhythms of the heart or extra beats in the heart, that can help keep the rhythm of the heart as normal as possible. And this can improve patients' quality of life. Other rhythm disturbances require specific intervention, such as surgical procedures, to try and treat it. And for example, slow rhythms of the heart, if they are causing symptoms to the patients, can be treated with pacemakers. Other rhythms of the heart, particularly fast rhythms of the heart, can be treated with procedures called ablations, which is where the actual area causing the problem or the fast rhythms can be targeted and can be treated with either radio frequency or freezing technologies. And these procedures are called ablations. But generally speaking, I would say that not all rhythm disturbances need interventional procedures. In fact, I would say that it's rare for rhythm disturbances to require surgical procedures, and they tend to be for those where the rhythm is causing significant problems to the individual. So this again depends on the type of rhythm disturbance that the patient has. For slow rhythms of the heart, for example, if it is left untreated, it can result in patients passing out due to the fact the rhythm is so slow that it's not able to effectively pump blood properly to the brain. So as soon as patients start developing symptoms due to slow rhythms of the heart, then we usually recommend treatment, and this is usually in the form of the pacemaker. Fast rhythms of the heart, again, if left untreated, in some will not cause any problems at all, and these tend to be for the milder rhythms of the heart, such as the extra beats or the ectopic beats of the heart. Some rhythms of the heart, however, if are fast and are left untreated, can result in the muscle of the heart getting weak, and this can result in conditions called heart failure, which can be problematic in the future. There are obviously some rhythms of the heart which are very serious, and these are rhythms occurring from the main pump of the heart called the ventricles. And again, if left untreated, can cause serious consequences. So again, it depends on the type of rhythm of the heart that the patient has as to whether it requires treatment. And if left untreated in some, it can result in some serious consequences.